Hi everyone, Amy Scalia with Sensi Chic here with Dr. Gupta at the Dermatology Laser and Vein Center. And today we're going to talk about scarring and stretch marks and all of those ugly things that end up happening over time. I know I have some, so I'm very interested to talk with you about this. So what are some ways that you address these things?
Yeah, absolutely. So first of all, scars and stretch marks can actually be improved, and there are really nice ways to do it. For scars, a lot of times patients just ask, well, how do I get rid of the scar? And it's really not as simple as having like one procedure that takes care of all types of scarring, because it comes in so many different types. For example, if we're just talking about acne scars, we can have scars that are persistent red spots on the skin, and to some patients that's considered scarring. And then we can have persistent brown pigmentation that's left over from acne. That is also considered scarring. We can also have pitted scars where it almost looks like somebody took like a pen and just poked holes in your skin. So those are ice pick scars or pitted scars. And then we can have scars where you've just lost some volume under the skin because of all the inflammation. And those are called rolling scars, where you don't have such a sharp edge on the scar, but you have sort of this indentation that's occurring. And then we have what are called boxcar scars, which are kind of a pitted scar but much broader base. Some of the procedures will work on all of these different types of scars, but for example, if we're treating pigmentation or redness, it will help stimulate collagen overall in the skin as well, of course, but it may not help as effectively on some of the scars that have the sharp borders or where you've lost volume. And we may need a procedure like microneedling or a energy-based microneedling device with radiofrequency or with lasers such as profractional or a laser skin resurfacing, where we're just going to remove layers of the skin and allow the skin to heal itself back. We would love to use PRP in conjunction with these procedures to get a better improvement. And then we can also use a new procedure called Morpheus 8, which is another fractional radiofrequency device. Venus Viva is another one. They work a little bit differently, but both of them are energy-based and are going to create that little injury in the skin that is going to promote the skin to re-heal itself. So we can use all of these technologies on the face, but off the face too. So they work great for stretch marks too. Mm-hmm. And we've had some really phenomenal results using profractional, Morpheus 8. The energy-based devices in general, when compared to a straight microneedling where we're just causing physical, mechanical columns of injury, is the heat actually really gives a much greater improvement in terms of collagen regeneration. Mm-hmm. So we do prefer the energy-based devices in patients who would be good candidates for them.
And it sounds like you really take a look at what the issue is and take an individualized approach to it.
Absolutely, you have to.
Yeah.
A lot of times with stretch marks, for example, we may also be dealing with loose skin, mm-hmm. or we may be dealing with a little bit of leftover baby fat, mm-hmm. And then we can decide how to address that. We may want to tighten the skin along with improving the stretch marks. Mm-hmm. And in that case, we've had some phenomenal results with the profractional laser, for example, where we've seen sort of these little penises just tighten back up along with the stretch marks improving. And some patients may just have very faint stretch marks. In that case, microneedling may be fine. We may not need an energy-based device. So it is just so variable. We've had a lot of patients come to us with self-harm scars, and those are always heartbreaking to see, but we do see those on arms, on legs, multiple body areas, and they do improve, and it restores their confidence. It's really heartwarming to see how we can really transform somebody's not just their appearance, but really their life moving forward.
Yeah, it goes a lot deeper. And sometimes with scars and things like that, you think that there's nothing you can do about it, so it's great to know that there are options.
Absolutely.
And to be able to come see you and really take that individualized approach to what's the best route for getting to that solution that you want to find.
Absolutely, yeah. So some sort of a physical controlled trauma to the scar that is going to allow it to re-heal itself in conjunction with PRP, and then sometimes we'll use injectable fillers. Bellafill, for example, is an excellent filler. It's actually FDA approved for acne scars, and so for those depressed scars, we can inject a little bit of filler and it gives an immediate improvement. So that's really nice.
Yeah, I would have never thought of that. I always learn so many new things. And make sure that you're following her on social, because lots of great information there, and you're able to find out about the latest and greatest that they're offering here and some of those great before and afters that she's talking about. And also go online to see the full menu of services here and be able to see where you can contact them. So check it out.